Hello, and thank you for joining us today. My name is Lisa Quenu, and I'm the new intern with the Equity, Inclusion, and Diversity Committee here at Mayo Clinic's Department of Laboratory Medicine and Pathology. I'm currently studying Global and Public Health Sciences at Cornell University, and I'm very excited to lead this project and show you the various career pathways at Mayo. For my first ever career profile video, I'm here with Leah, and she will be answering a few questions about her role and experience at Mayo. So now, Leah, could you please introduce yourself?
Gladly. Hi, my name is Leah. I use she, her pronouns. I was the previous EID intern. I'm so sad. My last week is coming up soon. And I'm currently in my second year of grad school. I'm finishing up my degree in public health, which is also very exciting. And yeah, I'm really happy to pass on the torch for this video project series.
So what made you choose to work at Mayo?
So Okay, so I chose to work at DLMP and Mayo Clinic because of how strong their push for EID was, which I thought was really cool for a hospital and a healthcare setting. Like I said, I'm studying public health, and as a public health student, one of the things that I really love to talk about is rebuilding trust in healthcare systems and health equity issues and all of those different things. And EID is so important in healthcare settings, because it's essential to increase like the cultural literacy among personnel, understanding amongst like health workforce people, and promoting equity inside of institutions can also improve cross-cultural care and overall the quality of care given to patients. And this is really important for testing, screening, so many different um, health needs of the population. And overall, EID is really important in building community amongst staff. But one thing I love about DLMP is how they try to engage with community outside of the Mayo bubble too, in terms of equity and inclusion, volunteering, and just giving back to the community.
Yeah, that's really important work. You already sort of touched on this a little bit, but could you talk more about how the work you do makes a difference for patients?
Ooh. So I feel like for me, it's a little bit difficult to talk more so on that just because a lot of the work that I've done was primarily with staff and staff related resources. And um, and I feel like a lot of people don't necessarily realize how improving um, the quality and the work quality, the work environment amongst staff really has this downstream effect to improve patient outcomes and improve the quality of care delivered to patients. And it's just, it's one of those things that's very overlooked just because I guess like it's not talked about as much. And it is all relatively new work that's coming out, even though it should have been there from the beginning. But it really is so essential to cross-cultural care and really meeting the needs of patients.
So what is or what has been your favorite part of your job?
Hmm. Okay, so in this role, there's so many different working parts. You help with different projects, writing newsletters, making content for the website, and this video series. There's a lot of different things that go into it. Um, it's hard to choose, but I think one of my favorite things was the video series and getting to know different staff in DLMP through the series. Learning more about website management and creating new content for the website is also really fun. One of my hobbies is like art and creative design, and I feel like I got to tap into that when it came to making content or making like animated presentations, all that kind of stuff. Um, Anything with a creative outlet for me, the best. But um, I don't know. I think just overall getting to do a variety of different things is, I know that's not like a favorite thing to do, but being able to have like a variety of things to do and things to try was really cool because it helped me figure out so many different things that I like and so many things that I didn't even know that I liked. Um, but I guess to boil it down, I would say like content management, making creative content, and getting to know people were my favorite things to do with this role.
Okay, so you talked about how your job has sort of been essential to like discovering more about yourself. So could you also share how it helps cultivate a sense of belonging?
hmm So I feel like this role really helped me find a sense of belonging in the sense that even though the internship is fully remote, I feel like people were still connecting with me over Teams. We were sending jokes and like emails, like, that kind of stuff. Um, and I feel like with remote work, it can sometimes feel isolating. And I feel like after communicating about, like, oh, sometimes going a couple of hours without seeing anybody, it kind of makes you like, oh, I wish I had like something on site or something like that. Um, I don't know, just being able to have more of that engaging component really made me feel like I was being heard and my concerns were being heard. And for the times that I was on site, it's just so nice to get to like meet people and see how welcoming everybody was. One thing that really stood out to me was the Juneteenth event. We ended up having like a DLMP booth at the NAACP's Juneteenth event in Rochester, and just getting to meet so many different Mayo staff and DLMP staff that I've been sending emails to or like having Zoom calls in person was really cool. And just having like so many genuine conversations. The music was going, the barbecue was going, like, it was just good vibes. And just little moments like that, it just makes you so happy to be where you're at. And those are the type of moments that I really appreciate with this internship. And they really made me feel like, wow, I could really work here. But
It's great to hear how Mayo Clinic has really influenced your sense of belonging and sense of self. For the last question, maybe you could touch on what your future looks like, whether it be at Mayo Clinic or anywhere else.
mhm. Yeah, so like I said, I feel like this internship really helped me figure out things that I didn't know I liked. And one of them is like website management, content development, like all of that kind of stuff. I've never really been with like the techie. I feel like that's not a good word to use, but like techie kind of stuff. And I didn't realize how much that I liked it or how much I would like it. And with public health, I feel like technology is such an important tool. Um, and something that I really like is health communications as well from my classes, but also from discussions that we've had, like at the RISE conference or just within our working circles. So I feel like in the future, I would want to do something with like health communications, health education, whether this be like internal to healthcare settings or for external populations from like healthcare settings across different groups. Yeah, I feel like health communications, health equity, that's kind of where I'm gearing towards. But we'll see. We're working things as they go. We're still students. So
Oh, yeah, that was the last question, but thank you so much for participating in the job profile bit.
yeah, thanks for having me.